I was going to say, are we live already on YouTube and they're writing this, calling us in? Okay. We can get some more, print some out for people. So this is a program that is administered through the Social Security, and it's a very easy application to do online. And let me see if I have. The income level is a little higher than what's on this book, on this blue sheet, because this one will expire in March. But for a couple, it's around $1,800 a month, and for a individual, it would be around a little over $1,300 a month. So you can see that income can be a little higher than a lot of programs that are available to folks. But this one is a big help and helps a lot of folks. The Medicare Savings Program is folks, and if we are not eligible for this program ourselves, we often know we have family or friends we know that may be eligible. There is a brochure here called Pay Less for Medicare that talks about programs that help pay for the Medicare Part B. It also will enroll them into the extra help for prescription drugs. So this is an excellent program to help pay for that $104 premium that folks have. And so the resource level is higher than normal MoHealth Net benefit programs that they have. It's above, as you can see, the resource limit is $7,160 for an individual and $10,750 for a married couple. And that does go up just a little bit in April of this year. So these are really excellent programs that help people pay for that Part B premium. And even if it only pays for their Part B premium, they also get the extra help. So maybe they can afford a supplement then to help pay for those cost sharings or enroll in a Medicare Advantage plan if they qualify for that second level one there, which pays for the Part B premium and gives you extra help. Great programs, and we're very happy to help you apply for, and to help anyone apply for those programs. And those are administered by our Family Support Division. This just shows, talks about what the QMB pays for the Part A, if there's a Part A, pays for Part B premiums. The one thing about the QMB program, it also pays like a supplement. It will pay for all of your co-pays, deductibles, and co-insurance. And that's a great benefit for that program. We do a lot of work to reach out to folks about this program. It also gives you a chance to change your Part D plan, including Medicare Advantage plans. So folks who receive extra help through Social Security or through the Medicare Savings Programs do not have to wait to that open enrollment period starting in October 15th. So perhaps they get a new prescription that's not covered by their plan and they can't get an exception. They can change plans without waiting until October to do that. And again, people are eligible based on their income and their resources. This one pays for the Part B premium, the Slim B one. We call it Slim B. Don't you love how we make up words? And then it will help pay for Part D basic plan. And again, people have the opportunity to change plans if they need to. I wouldn't recommend doing that, only if there's a need to do that. And then QI1 pays for Medicare Part B. And it's very similar to Slim B, but it's a higher income level. MoHealth Net, of course, is basic Medicaid, which will also enroll people into extra help for prescription drug plans. And they also qualify for continuous enrollment into a Part D plan or an Advantage plan. And it will reduce co-pays and eliminate deductibles and help pay for their premium. Now, you know, you cannot learn Medicare in an hour. I don't know, have we been going an hour? But I think you all know Medicare, based on your questions, you at least understand what Medicare is and that it's a really wonderful insurance that we have. For the most part, I always say Medicare works 99.9% of the time, and then when it doesn't work, just give us a call and we'll help you unravel that. That's what our program is here for. I know based on the folks that I have met at the conference and doing this presentation that many of you would be wonderful, wonderful volunteers to help people. And I want to encourage you for considering to apply because one, we give you more than an hour's training. We give you 4 days of training. We ask you to take 12 continuous hours of training. We ask you to commit to so many hours a month and to practice what you learn by helping other folks. I have the most wonderful team of trainers that know Medicare inside and out. And I believe me, if they don't know it and they don't have the answer for you, they know people who can help you. And it's a way to help, like your questions today, you can help people just answer their questions, be it a simple one or like, my enrollment totally got messed up, can you help me? And so we're always looking for people who would really like to do that work. We just had a training. I was thinking, oh, darn, I wish we had here in Jefferson City, I wish we had done this maybe a couple of weeks ago, but we will have another training. I know there's a training coming in St. Louis soon. So if anyone's very interested in helping, just give us a call or let me know and I will send you an application. It's a very rewarding opportunity. Volunteers who stay with us, we ask for a year commitment, 6 months to a year commitment. Most of our volunteers stay with us for about 3 years. And if they make it to that 3-year mark, I've just recently had some that just retired after 20. And I think they just got tired of that computer and other things. And plus they ready to go do some other. But I know that we have some time for some questions.
Yes,
Are we
do.
So, yes.
Yeah, and Social Security.
Okay.
I know they have special permit used to work in civil service.
Mhm.
You cannot draw the full benefit of Social Security. They got a special scale they use. I'm not sure if that's still in effect or what.
So the question was, if you were civil service and didn't pay into Social
No,
Security, you did,
right.
but maybe did not have enough.
No, you pay your 40 quarters.
40 quarters, okay.
And when you retired, you couldn't get the full benefit. They have a special formula they use for civil service.
They make, is this some of your retirement benefits also from the civil service?
Yeah.
That's probably the reason why. I really don't know what that formula would be, but I know that some federal employees we always have to ask a lot more questions because some people don't even have Medicare if they're a federal employee. Some have paid into it, so it may affect your the Social Security cash benefits, what you're talking about, based on it might be offset some by your civil service retirement. Yes. Yeah. Good question. Yes.
Going back to supplemental insurance,
Mhm.
talking about you can change the plan.
Mhm.
You said something, you can get the same plan or lower, but not higher. Why not?
Because a person who's changing their plan, you're getting the same benefit. You just don't have a guaranteed issue for a plan that may be at a higher level. So it's why it's really important when people purchase their plans initially that they're purchasing a plan they think that they would want to use long term. It's insurance. And that's what we always have to remember. It's insurance. You would probably pay a higher rate too. And if they did sell you one, they don't have to give you the guaranteed issues. So they could consider pre-existing conditions. So it's not like you couldn't purchase a higher rated plan, but the rate, may be higher and they could consider pre-existing conditions. Very good question. Yes.
Let's move to St. Louis. St. Louis, do you have any questions?
Yes, we do.
Oh,
Hooray.
good. Okay.
Yes, like, what is the, insurance that I'm using when I'm traveling, when I travel? So, one doctor to another. She said, what is the insurance that she should use when she's traveling to one doctor to another?
Well,
What part, what claim? She said, what part and what claim should she be using?
okay. If you're enrolled in original Medicare, Part B, as in boy, will be paying for your doctor's visits. If you are enrolled, Part B, but if you're enrolled in a Medicare Advantage plan, you would need to make sure that those doctors are in the network of your Medicare Advantage plan.
What is the mileage? I mean, how far can I go with this?
If you're under original Medicare, any doctor that accepts Medicare, I mean, you could be traveling in the United States and a doctor would accept
No.
Medicare.
No, I just want to travel from Normandy to St. Charles.
So if you have original Medicare, any doctor that accepts Medicare would, accept your Medicare card. If you're in a Medicare Advantage plan, you would need to make sure the doctor in Normandy accepted your Medicare Advantage plan. Without looking at your card, you would need to check. If you have a Medicare Advantage plan and want to know if a doctor accepts it, you can call the doctor or you can call the plan. Good question.
Okay.
Usually within the St. Louis area, if it's a St. Louis plan, it's going to cover a lot of the St. Louis area if it's a Medicare Advantage plan. Good question.
St.
Okay,
Louis?
we have a couple more questions.
Good.
We have a couple more.
Go ahead.
I wanted to know if you have an advantage plan, does it cover all of the Medicare preventive services?
Yes. The question was, if you have a Medicare Advantage plan, does it have to cover all of the Medicare preventive services? If it's covered under original Medicare, it has to be covered under the Medicare Advantage plan. And if it's not, we need to appeal that decision. We need,
What kind
Okay,
of
we
comp
have
are you
one
looking at?
more question.
huh?
Two more.
Okay.
My question is, does Medicare pay 80% of everything? I noticed my bills I've gotten lately, they are only paying 70-some%. And if my secondary insurance pays, then it falls on me.
Medicare should be paying about 80%, and then your co-insurance, your supplement would pick up the out-of-pocket cost. If you have an employer plan, if you have an employer supplement, it may pay differently. Medicare is going to pay the same.
It's employed.
So,
It is employed.
okay. So, and is it primary? Are you still working?
And it's paying 70-some%
Okay,
on
of the copay. Of the copay versus the 20%, versus all of it. Yeah. With employer insurance, that often does happen. It doesn't necessarily pick up all of the copay. It may only pay a percentage of it.
Okay.
Can I think of one more question?
Yes.
If you are on the QMB plan and you've been on it for a while, and you go to the doctor, then they tell you that they're not paying, how do it just automatically expire? Do you have to re-sign up for it again?
Okay, if you are enrolled in a QMB program, you do have to reapply every year. There should be a reauthorization. So if you don't know for sure, if you're still, if the program has not been renewed, then you need to file a new application. I would call the family service worker to find out if it had lapsed.
Any more questions from St. Louis?
Good questions.
We did not hear the last answer.
Okay, so if you have a Medicare savings program such as QMB, you do have to reapply or do a new application on an annual basis every year to continue with that eligibility. So if the doctor's office is saying it's not paying, it may or may not be because that the program has lapsed. It could be that there's a billing issue, but I would call family services and find out if it's still current or if it's not.
Okay.
And so you may just need to make a new application.
Okay. Anyone else?
Okay, thank you.
Good questions.
Thank you, St. Louis. Any more questions from Jefferson City? Well,
What kind of costs are we looking at everything above D on the average? You know, all these different other plans that come under.
Under Medicare Advantage plans,
Yeah, right.
a Medicare Advantage plan can have a zero premium, or it can have another premium or larger premium attached to it, and plus you would have the cost sharing for a Medicare Advantage plan. So that's why you have to just sit down with pencil and paper to figure out which plan how much out-of-pocket cost are you willing to pay, or maximum amount.
So if the person say, I want to apply for it, they don't have any guidelines.
They are. We use the Medicare Plan Finder, and maybe I can go out here. Andrew, can you help me? And I'll show you the website if we have time, Deb.
you have 10 minutes.
All right, we got 10 minutes. Let's go. I want to show you two things on the Medicare website. The Medicare website will show you the different Medicare Advantage plans. It will also show you the different Part D plans. Now, if you're asking for someone, if you are a civil servant, don't mess with your benefits.
Right.
You got really good ones. But if you're helping someone else, this is a great website for people to visit. I'm not always all about technology because so here, if you want to compare plans or your Part D, this is where we go. We go to the Plan Finder, and it's very simple to use. You put your zip code in. Then after you put your zip code in, it asks you a few questions. And I think it says, if you don't know, just say you don't know. Add your prescription drugs, and you can compare your drug plan. And you also can compare for Medicare Advantage plans. A lot of people like to do this even when they have an employer plan to see how good their employer plan is doing. The other, so this is an easy way to compare. So for example here, I'll just do this, 652, it's 65109 right here. Okay. And so we'll say we have original Medicare, and we'll just say, I don't know. So here is where you would just add your drugs. Let's see, let's put, someone give me a drug, an easy one to spell. Can't think of one. Oh, I know. Did someone say something? Okay, so we'll say warfarin. I only know that one because that's what my daddy took. So, all right. So we are going to find my drug. Well, obviously I didn't spell that right, did I? So and then you just say add drug. And we'll just say 5 milligrams. We don't want to spend too much time doing this. So here you are. You have your drug list. And on here, this saves your drug ID. So you would write this number down. So once you got your drug list in here, you wouldn't have to go back in and put it in a million different times. You can just put that number in there when you come up to that page, and it'll pull up your drug list. We'll say our drug list is complete. We're going to pick a pharmacy. Oh, my husband liked Gerbs, so we'll go to Gerbs. When we lived in Jefferson City. Okay, so now we're going to continue plan results. Am I being click happy? And then here, so let's say we wanted to look at the Medicare Advantage plans. There's 10 of them here. You can just click on that, and it will pull up all the 10 plans in this area, or any state that you wanted to look at if you were helping someone in another state. So here you would have the ability to look at the different plans, and it would tell you how much they cost. You can go in here, and it will tell you the cost sharing. So very easy to use. I know it's very hard to see somebody just kind of click through here like this. I wouldn't necessarily like this way of doing it. But here you could go to the health plan benefits, and it will give you an example of how much it would cost. So the out-of-pocket cost for this, you would not spend any more than $3,050. There's no network. There's no premium. You say $15 to go to the doctor, $45 to see a specialist, 20% for wheelchairs, oxygen, medical equipment, $65 if you go to an emergency care, outpatient 20% of the bill, inpatient $500 for day 1 through 3. So it does take a little time to kind of study this. I'm one of these folks that I like to take this and put it on a piece of paper. Yes?
Can your drug costs vary from state to state?
It can vary just from plan to plan. Just plan to plan. So one of the things that, and then just one more thing, and then I'll be quiet, Deborah. Get me started, and then I just get. So well, this is log into my Medicare.gov, and this is what I wanted to show everyone. This is a really great place for you to keep track of all your Medicare summary notices. All it requires is a username and password. So if you are computer savvy, you can put all of your prescription drug list in there. You know, the last time you had your last exam. Because if you're like me, oh, I just had that last year, and then I'm 3 years late. And so then the doctor's mad at me when I go in. So this is a great way to help you do that. You can just go create an account, and you'll get your Medicare summary notices a lot quicker. You do not get them, though, for the Medicare Advantage plan. That's unfortunate. It's unfortunately right now it only goes for original Medicare. I have to say I enjoyed this. This was the quickest hour, and I know that I like told you so much, but just know you can call our number, and we'd be happy to help you. And perhaps maybe we can do a fun, now that you're all experts, we can do the Jeopardy game.
I think so.
And you can come, or we'll play bingo or something. I have a couple of games that we can play. So, all right.
All plans that you go into for for prescription drugs, do they all have to have a list of your medication before they determine if they're going to take you or not?
No.
No.
I mean, it's not. No, you can just enroll in any plan, but it's always good for you to know that they cover your medications.
Oh, that's why it is.
Right.
Okay.
Yeah,
Thank
that you know.
We obviously need to have a part 2, don't you all think?
Yeah.
I think so too.
And take one little section.
I agree.
Yes. One more question.
Yes. Go ahead, St. Louis.
Okay, the Part B premium, and you apply for the discount where the state will pay for your Part B premium. How far they will go back and reimburse you out of your check once they approve you? Will they go back and reimburse that money that you have paid into this plan?
Yes, they will. And I believe, right, they will go back, I think it's a month after I think you're eligible the next month after you apply. And if it takes them more than, if it takes them longer, like 90 days, if it's more than 90 days, you should give us a call, because they usually try to get that done, but they do go back and reimburse you for the time that you became eligible for it.
Okay.
Okay?
What is that called?
Okay, what is the phone number to call?
The number is 1-800-390-3330. 1-800-390-3330.
And there is a claim representative here that comes to the center on Tuesdays and Thursdays. She's here between 9 and 1 p.m. She will be here tomorrow, by the way.
Yeah.
Her name is Miss Gail Carson, and she's been a volunteer for the past couple of years coming here to this site. So.
Yeah. And she is very knowledgeable and very good.
Well, I hope you have enjoyed this informative Medicare 101. Please join me in a round of applause for Ms. Carol Diaz.
Thank you. I enjoyed it. Thank you. Thank you to all of you.
Before we officially dismiss, I have two announcements. Yeah, I just announced one. I have one more, and then we can dismiss. Of course, on your agenda, you have an announcement at the bottom. And next month is Minority Health Month, and the national theme is 30 years of advancing health equity. And we will have a lunch and learn next month. And it will be, of course, on Wednesday, April 29, 2015, here at Lorenzo J. Green Hall. And it's from 10 to 12. And we're hoping that the sites, especially St. Louis, you all have really been following right along with us with our special learning journeys that we just started today and our lunch and learns. So we look forward to seeing you again, St. Louis. Hopefully the technical difficulties will be rectified for the Boot Hill, and Kansas City will be joining us again as well. Thank you. Goodbye, St. Louis. Goodbye. And goodbye to you all. Hope to see you back next month. Oh, please complete the evaluations.
I can have one.
You should have one. It's in there. Yes, you should have an evaluation.
Oh,
Yes. Yeah.
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 That's the first thing I thought I looked for.
I'm going to call it the one to pick you up.
Are you staying for long? I got out that 300 and something. We had to buy that was the medication before. I got out of there.
We're ready to come back.
Yeah.
Yes.
Okay, tell us guys, we really waiting.
Tomorrow night.